Welcome to Talk of the Town. I'm your host, Janet Cresson. We start off today talking about the power of your smile, and research has proven time and time again that it helps provide health in our bodies, minds, and even relationships, not to mention making a good first impression. But if your smile isn't quite what you wish it would be, there is help. And with me, I have periodontist Dr. Joseph Cristoforo. Thanks for stopping by, Doctor.
Good.
So let's start off. What is a periodontist?
Simply put, a periodontist is a dental specialist who focuses on the recognition, prevention, and treatment of periodontal diseases, and also provides dental implant services. Periodontists are often called upon to treat patients with more complex problems, working in concert with general practitioners and other dental specialists. In addition to providing patients with surgical and non-surgical services, periodontists are very often involved in cosmetic procedures, aiding general practitioners in planning and executing smile makeovers.
Okay, smile makeovers. That's right there in a nutshell, isn't it?
Right.
So you mentioned periodontal disease, and that's a pretty important thing. Tell me a little more about that.
Periodontal disease is a bacterially induced inflammatory condition that leads to breakdown of the supporting structures of the teeth, namely the gingiva or gum tissues, as well as the underlying jaw structure. As periodontal disease progresses, oftentimes active infection ensues and people lose teeth unnecessarily. In addition, periodontal disease is often associated, or has been associated through the research, with many medical conditions, such as diabetes, heart disease, stroke, respiratory diseases, even cancers. And this is through the fact that periodontal diseases share certain inflammatory pathways that are in combination with these other medical conditions.
Wow, that's quite an effect. And sounds like it can be preventable if we can get a start
Preventable and treatable.
And treatable, which is where we come into place with dental implants?
Correct.
Oh, okay, what are those?
Dental implants, simply put, are artificial tooth roots that allow us to replace a single missing tooth, multiple missing teeth, even a whole jaw of teeth. When dental implants were first developed 50 plus years ago in Europe, they were used to anchor dentures, patients who were without all of their teeth, and we still use them to this day for denture wearers to secure a denture, giving them much better chewing efficiency and really changing their quality of life.
And that's a great segue. What are the benefits? Obviously, function, appearance?
The two main things, and I always talk to patients about, it's increased function, it's increased aesthetics.
Yeah.
And depending on different patient needs, obviously if they're replacing a front tooth and aesthetics become more of an issue. If it's a back tooth, chewing efficiency or function becomes more critical.
I imagine, with the aesthetics, even just forget about function, even though that's so critical for eating and things like that, but just the aesthetics of imagine folks missing out, staying at home, or just not enjoying life as much because they're not smiling, they're self-conscious about laughing, that kind of thing. You mentioned cosmetic services. Can you explain that?
Yeah, in addition to dental implants, like we were just speaking of, replacing a missing tooth, particularly a front tooth, as periodontists, we oftentimes are called upon to provide primarily two cosmetic services. One would be gingival or gum grafting, where patients may have exposed tooth roots due to gum recession. Oftentimes, these exposed tooth roots will allow patients or have patients look older than they actually are, quote unquote, long in the tooth. I beat you to it. Oftentimes we will replace this missing gum tissue with a cosmetic gingival or gum grafting procedure.
Interesting.
Also, we're oftentimes called upon to correct the gummy smile. A patient who shows very little teeth, a lot of gum tissue. I always tell patients, if you look at popular magazines, Cosmo, Glamour, when you look at the models on the cover, they're all teeth, right? You hardly see any gum tissue. And there are a lot of patients who are embarrassed about their smiles because they do show too much gum. And in those cases, we'll sculpt the gum tissue, exposing tooth that was previously unexposed, and really give them kind of a life changer.
Yeah, that would be life-changing. You're really helping people out. We're out of time, Dr. Joe. Thank you so much for coming in today. That's all really fascinating information.
Good stuff. Thank you.
You bet. We'll be right back with more Talk of the Town.